Yeah, I got numbness in my feet for the last 8 months, so I've been coming to try and get rid of the numbness.
Okay, very good. What we're going to demonstrate is a combination of needling technique combined with microlight therapy. Dr. Starwynn is going to demonstrate the needling technique on the feet, and I will be demonstrating the microlight techniques on the lower back and the legs.
This is an example where needling techniques really accentuate the value of microlight. And so peripheral neuropathy is a really challenging condition to treat, and there's really not any very good medical treatments for it. But this combination has been very, very effective, and we're going to show you how we do it now. Fred, why don't you just lay face down here on the table, and we can put your ankles up here in these bolsters. And is it okay if I just expose your lower back there?
Oh, sure.
Okay, thank you. So some of the points that are really valuable for actually increasing nerve function in the back are the points called Liao points, which are in the sacrum. And I'm going to use a 1.5 inch needle for treating those areas. And the other ones are points that are in the feet, which are in between the toes. They're called Shangbaxi points. And these are actually also points that with a moderate, let's say 1 inch needling technique, are going to be able to also stimulate increased nerve function, and it does reduce numbness and pain due to neuropathy. So I'm just going to swab off these areas here on both feet. So here we have some 1.5 inch needles, disposable, sterile. Basically, I'm just palpating here for where the foramen are, the Liao points. Does that feel okay, Fred?
Yes, that's fine.
No discomfort?
Mm-mm.
Okay, so we're in about 1 inch into the body right there. You actually can go deeper with this technique, but I'm just doing it moderately for today. Sometimes I'll use a 2 inch needle for this, and then one on the other side. Basically, it feels like a dimple there on the sacral area. Okay, is that all right?
Yes.
Thank you. So I'm usually do about 4 points in this area, and this has been a really good complement to the microcurrent therapy. Let's go down a little bit to approximately the sacral 2 zone. Palpate for a foramen there. Now I know that electro-acupuncture previously has been often putting clips onto the needles and attaching it to a stimulator. I personally do not like that technique. I think there's too much hazard associated with it. And most of the stimulators used for that purpose really put overly strong currents that I think really do more harm than good. They may give some temporary analgesia effect, but they actually can actually have more of a rebound pain problem. That's why I don't really like them. Microcurrent is way better. So here you can see these 4 needles. I'm just going to twist these every now and then and do a little extra stimulation. And then moving down to the feet, we're now going to focus on the feet area. So for these, the boxy points are in between the fingers, and they're in between the knuckles of the finger. Shangbaxi means below, and those are in between these metatarsal joints on the feet. So anyway, these needles are going to go in between the toes. So basically just lift up his foot. If anything hurts, Fred, please tell me, okay?
Yeah, that's fine.
Of course, you could do this with the person sitting up, but because I'm working on his back, it's more convenient to do this in this position. repeat the same needling procedure on the other foot. I threw in my insertion tube. Get this thing going out. I'm now doing it on this foot. So as you can see, the Shangbaxi points, there's one needle going in between each of the toes in the web area and going in at a fairly steep angle. An ideal insertion is somewhere between 3/4 to 1 inch. I'm doing it a little bit more shallowly here today. So here you can see all these points in place right here. So the needling aspect of this treatment is needles and the Shangbaxi points, and I've selected 4 of these called Liao points in the sacrum. And now, Dr. Sherman, would you like to come in, because this is your patient? Go ahead and show me what you're doing with the microcurrent part of the treatment.
The next part of the treatment we're going to add in is what we call a scrambled polarity treatment. We're going to be doing 4 pads in a scrambled pattern from the knee to the ankle in an effort to help reset the nervous system. So I'm going to show you how to set up the pads. I'm using microcurrent preset number 2, that is the polarized setting, using a 4-pad treatment. So I will be using all 4 channels on my Accutron because we will be treating both legs. So I take my channel A pads, show them right here, and the red is positive, the black is negative. My red positive pad, anything tender right there?
No, I'm fine.
Okay. I'm in the area of about gallbladder 34. My positive pad will go here. My negative pad will go on the opposite side on the inner ankle. So I have channel A, positive, negative. My channel B pads, I'm going to do the opposite. Positive to negative. Again, red is positive, right here on the outer ankle. Black is negative on the inner knee. Anything tender here?
No.
No. Sometimes it's helpful to find a tender spot. If not, not. Okay, so this is what it looks like. Again, channel A, positive, negative. Channel B, positive, negative. And I'm just going to get these 2 channels going. And I'm going to repeat it on the other side. So channel C, red is positive. Black is negative. And channel D, red positive, black negative. Same setup. And this is going to run for 10 minutes. Again, this is a microcurrent treatment, so we're working at a very low intensity and frequency. So the chances are the patient will not feel the tingling. Some people are a little more sensitive than others. They may feel a slight tingle, and that's perfectly acceptable. But even if they don't feel it, it's still getting in there and it's doing the job. So we're going to let this run for the next 10 minutes.
Okay, Fred, well, you've gotten a really deluxe treatment here for Dr. Sherman and myself, so why don't you just really slowly and gradually get up. Just sit up for a moment, let your head clear, and what I'd like you to do is just maybe walk back and forth a few times here, just right here in front of the table, and just say how your feet feel and how you're doing.
I'll fall down.
Yeah.
Yeah, no, I mean, they feel better.
Better than when you came in?
Yeah.
Well, that's good. Yeah, that combined technique we've had a lot of success with.
Yeah, there's more sensation and I can feel the floor better and yeah, I mean, they're less numb.
Well, that's very good. We thank you so much for coming in.
Okay, thank you.
Thank you very much.